your life, you deserve to be more, do more, have more, and give more. And now the Becoming More podcast with Dianna Kokoszka.
Welcome to Becoming More, a podcast where we help each and every person become more than you were yesterday. I mean, after all, becoming more is not an option. It is a necessity in today's world. Today, I have Dr. Dianna Kokoszka with me. As owner, president, and CEO of Health Restoration, Inc., HR Pain Management, Inc., he has built a proficient team of healthcare professionals, including medical doctors, nurse practitioners, neurologists, chiropractors, neuropathy, massage therapy, nutrition consulting, and timeline therapy. Boy, you offer a lot.
We do.
Yeah, it's to help us actually get better, prevent. And you've earned a Bachelor of Science in Human Anatomy, and you've got your Doctor of Chiropractic degree from Logan University right there in St. Louis, Missouri. So Dr. Kokoszka is also a certified massage therapist. Dr. Kokoszka is also a certified massage therapist and has completed several other certifications, including the advanced training and degrees in sports medicine, MCU protocol developed in Melbourne, Australia, and neuro-linguistic programming.
Yes,
And all of these have helped you and your patients.
absolutely. Because healthcare isn't just, one size fits all anymore. We have to find where on the spectrum of healthcare the patient is at. So that's where the more diversified the doctor has in their education, the better off they are in finding that. And not any one doctor can know everything. So that's why I wanted to put together a team of professionals from all, from different rankings on that spectrum of healthcare provided, so that we can offer as much as we can to the patients at one location. Because it's not any fun to go see specialist after specialist and you have to travel all over town. You have to go way over here and then 20 minutes away and fill out paperwork every place. It adds convenience, but it also adds safety.
Well, the thing I love about that is you collaborate.
Absolutely.
And you talk back and forth with one another.
Yeah.
And therefore, you're giving people the very best. Now, I also want to make certain that people know that you've earned a fellowship in the International Academy of Medical Acupuncture at Logan University.
Yes.
You bring a wealth of knowledge and expertise to your practice, along with the other people that you collaborate with. And you've received numerous awards. I mean, Congressman Tom Reynolds gave you an award in 2006, the Congressional Medal of Distinction in 2006, and you've been listed in Who's Who of American colleges and universities from 1998 clear up until 2001. And you've taken a little bit of time off. I know you had a few setbacks, as we all do, and you've been teaching assistant. You've been a teaching assistant to the professor, Gary Rank, a PhD in anatomy and physiology, where you assisted in educating the next generation of healthcare professionals. So it's not only you that's doing this, now you're helping the younger generation come up so they can help us. They're actually going to take care of you when you get old.
That's what I'm preparing for. Yes, we got to prepare the road ahead. So a lot of that was, yes, I'm no longer as politically active as I used to be, because I wanted to help shape the healthcare system in a place that it was access for everyone. At the same time, gave us more of a larger spectrum, because we can't just have one type of healthcare option in this country. We need the whole spectrum, because it's not about waiting until everything is catastrophic and then we go in and fix you, because that's kind of the healthcare system we have now, and it's a little bit on the broken side.
Yeah, you wait until you're ill, and then you go pay the money to get better instead of paying the money up front so you don't get ill. Now, I just really want to say that you're a member of the Physical Advisory Board and you focus on healthcare reform. And that's when you really got politically active, because you wanted to go in and change the way that things were done. And I really appreciate that. Now, I think one of the greatest things about you is that you're my son. So let's get that out of the way right there. And you definitely helped me and Tony stay looking young and feeling young, right?
That's what it's about.
So that's why I thought it would be so good to have Shane come and help us so that you can become more in your health. because without your health, you don't have anything. Now,
Right.
Shane, you do have extensive education, lots of certificates. Um, you've accomplished so much, but yet you still have hobbies. You
Oh, of
like to
course.
water ski, you boat, you golf, you're a pilot.
Yes.
You've got your own plane. I mean, you love to travel. You're an avid reader, a movie buff. I may go into some of the movies with you later. Yet, with all this extensive education and your certification, I know there's pollen here in Denver,
Yeah.
really bad right now. I'm feeling it myself. And yet, in this healthcare, to give people the optimal health and wellness, what are some things that we should be doing daily to help us?
Daily is going to start off with sleep, rest. And so if we get the proper amounts of rest, that gives us a good chance to really hit the ground running first thing in the morning.
Well, people say, oh, I only need 5 hours of sleep. Is that true?
That's not true.
Yeah.
That's really untrue. That's that you can function at that level.
Yes.
Can you, but are you at your best, at your peak? Does your body have the chance to go through the rhythmic cycles that it has to go through? Because here's what I have to tell all my patients is just because technology has advanced, our bodies have not. Our bodies are still the same ones we've had when we were cave people. So 10,000 years ago, same physiology. Not very much evolution has changed over the past 10,000 years with us, but technology has. We can stand in front of a microwave and say, hey, I don't have all minute for my dinner.
Yeah.
But our bodies don't heal that fast. They don't recuperate as fast.
Well, as we get older, it takes
that
longer.
even slows down. That slows down even more. Sorry.
No,
Sorry. I wish we had a different answer for that. There are things that we can do to keep our energy levels up, to keep our brains and our minds at their sharpest points, to keep our physiology at its best. So the part that I like to focus on the most is one of the most important parts of every single cell in our entire body. It's called the mitochondria. That's called the powerhouse of the cell. So the mitochondria develops through an electron transport chain. It breaks down food different ways, and it takes the electrons off of the food and basically puts it into the mitochondria through what's called ATP. Don't worry about this technical stuff too much. That's my job. So basically, we want to take care of these little engines inside of every cell of our body. So there are ways that we can support those. There are the ways that we can build those, the way that we can improve their function, and we can keep them going as we age. So yes, we are all getting older, and sorry to break it to you, but none of us are getting out of this alive. How is it, between, on our tombstone, we're going to have 2 dates with a dash in between, right? Born and the time we pass. But it's that dash. What's that?
So what you're desiring for everyone to do is to learn how to take care of themselves so they have the most energy that they can have. And so just to educate us just a little bit, what's the difference between an MD, a DO, and a DC?
I'm really glad you asked that question because ultimately, there's not that much difference in education. There is a bigger difference in philosophy of how to approach the body, how to approach the patient. So the medical community was born, and all 3 of these disciplines early in their infancy, 1800s coming into the 20th century, they were all collaborating together and basically had everything the same. The advent of pharmacology, as it's taught, or the title as it's taught in school is called toxicology, but in pharmacology, that's the advent that medical doctors grabbed a hold of, and they ran with that. It has a very important place in our society, in our healthcare system, saves hundreds and thousands of lives every single day. I really respect that. That's why I brought that into the clinic and said, hey, these guys think and treat a little differently than I do. So let's bring them into the picture as well, so that we have that opportunity to offer that to our patients at the same time. Because chiropractic can't do everything. Acupuncture can't do everything. Medicine can't do everything. It's all that spectrum stuff that we were speaking about. So medicine and medical doctors, osteopaths or DOs, chiropractors or doctors of chiropractic have relatively the identical same education coming out. So MDs, when they graduate, they're primary care physicians. Doctors of osteopathy are very similar to that. chiropractors or doctors of chiropractic, when we graduate, have the same education and technically are trained just like primary care physicians in this country. So it's the states that dictate what we can do by state law. That's the advocacy stuff that I started back in 2006 and stepped away, started working more behind the scenes. So I'm no longer in the limelight with that. But that's the difference, is it's all philosophy. The similarities are, there's more similarities between us than there are differences.
Okay, and they're all needed.
They're all needed. Every
That's
single
that's
one
the
of them.
greatest part about, because, well, how do these different disciplines work together? Because you brought them all into your clinic
Yes.
now, and you say that you collaborate and you
Yes.
talk about the patient to give them ultimate health.
Okay, I'm going to approach that first part. So MDs and DOs are very similar in their approach to the body. So they're going to look at it as, well, let's find out what's going on with them, properly diagnose them, and then let's give them something to alter and change. Chiropractors they're the peak and pinnacle of your alternative healthcare, if you'll look at it that
Okay.
way. Okay. So if you look at things from the alternative to keep you healthy, that's a chiropractor's viewpoint, is I don't want to wait until you're sick. I want to keep you from getting sick. Once it does happen. We all get sick. Once it does happen, then my medical friends and my osteopath friends get to come in and treat. So we treat once you're, to keep you healthy. Then my medical friends come in and treat if you're in a place where we need to bring in some more powerful types of treatments, because there's a lot of things that medicine does that is very powerful, very effective, and it needs a very, specific eye to oversee that. That's not my specialty. That's, my MD that works with me, that's his specialty. So we kind of take it from team standpoint.
Well, a lot of people wait until their back hurts, their knee hurts, and then they go to a chiropractor.
Yes.
Why should they go to a chiropractor? I mean, should they go once a week, once a month, whether they're hurting or not?
Great question. So that's actually going to be an individual question for each individual patient based on their needs and their age. So somebody who's very young and very active and very healthy, they don't need to be seen very often. Those patients may be seen every 4, 6, 8 weeks or so. Somebody who is a little more active, even if they're young. So my athletes, sometimes I see them once a week just because they're training hard, they're physically active. The patients who are just your average weekend warrior, we don't need to see them that much.
Well, and with you having the sports medicine behind you, that helps a lot with people like that. And so I know you do acupuncture.
Yes.
You do that on me all the time. And I'm a big person. I believe in acupuncture because it's all about energy going through the body. A lot of people are frightened because they think these needles are going to be like a shot needle going in them, right? And they're so little.
Yes, they're very, very tiny. I can fit 5 to 6 of my needles down the shaft of a needle you get a blood draw with. So that's just a size comparison.
Okay.
Also, when you get a blood draw, it's a beveled edge and it's big and round because it has to cut to create a large enough hole to pull something out of you or push large volumes into you. So my needles are only going to go into the dermal layers or the skin, which is maybe about 1/8 of an inch, just teeny tiny amounts. And that allows for stimulation of the acupuncture point to then allow the nervous system and the energy systems in the body to be affected and do their work to balance you, because it's all about balance. Every aspect of healthcare is about balance, keeping everything in line.
Well, it's interesting because I had some of the people in MAPS and they would come to me and they'd say, oh, no, MAPS is where I was CEO. It's Mega Achievement Productivity Systems, for those who don't know. And it was interesting because I would say, oh, have you tried acupuncture? And they'd go, I'm not doing acupuncture. Well, would you mind if I just had somebody experience that with you? And they'd finally go, okay. And then afterwards, it was like they were hooked. It was like they wanted to go back every other week to make sure they had that energy fix.
Yes.
And people ask all the time, how do you have so much energy? I think it's because of chiropractic, acupuncture, massage, the things that you taught me that are very important.
Yes.
So how do you motivate your patients to actually want to do that? Like me.
let's look at it this way. You know the difference between a race car and just your average car, right?
Well,
It's
yes,
performance.
right.
So how do you think those race cars get to those performance levels?
Well, they have a better engine, they tune them up, they keep everything going, make certain they've got the right amount of oil.
Absolutely, absolutely.
Yeah.
So, engines aside, so there's differences between horsepower in those. So, just engines aside, the difference is because you and I drive our daily cars, and we drive them and drive them and drive them and drive them and drive them, and then pretty soon we're like, oh, it's been 5,000 miles. Let me go change the oil.
Right.
They break down these race car engines and rebuild them almost after every single race. So they test them and they race them and they tune them and they take the engines out and they rebuild them. They're constantly working on those to get the best performance out of those engines. So it's not just the five levels as far as choices or five levels of performance. We have bad, we have average, we have good, excellent, and elite. So the difference is you and I drive our cars, and that's kind of that good level. They're at not only that excellent level, they're at elite level of performance and function inside that car. So that's what I want to do with the human body, is I want my patients to not just have good, I want them to have excellent or elite function in their body, whether it doesn't matter age, it doesn't matter performance or what they're going after, if they're a weekend warrior or they just like to hike, or, oh my gosh, I'm an athlete, I'm out there competing every single day.
Well, it's interesting because like I'll travel to get good health care.
Absolutely.
And a lot of people don't want to travel across town.
Sure.
So how would they know? And a lot of our listeners, they don't live in Denver, Colorado, where you're at. If you do, go see him. Yet, Shane, what happens? What should they look for? Because there's a lot of chiropractors out there. There's a lot of DOs. There's a lot of medical doctors.
I would try to find somebody who has a multidisciplinary facility. That's where multidisciplinary, we're talking about MD, DO, DC, the medical doctor, the osteopath, the chiropractor, those are different disciplines, massage therapy, different discipline, physical therapy, same thing. Where can you find that's a place that has all of those in one spot or that are relatively close together? And do they talk to each other? Because it's about the collaboration that you were talking about. Yeah, I want more than one brain thinking about me. I want more than one set of eyes looking at what's going on. It's also about the communication that promotes safety inside of healthcare. Because when you have doctors that communicate, their patients not only have better outcomes, they have safer outcomes. Because sometimes a patient will, if you're one of my providers and patient A comes in to speak with you, and then later they come and speak with me, I might go up and say, oh my gosh, did Susie, Betty, whatever, come and talk to you about XYZ problem? And you might say, oh my gosh, they didn't even mention that to me. Did they mention to you that they're on this or they had this medication or this surgery in the past? There is a lot of stuff that they don't tell each provider because not every patient comes in with their laundry list of things that they've ever experienced in life, or current medication lists or different things. So that's where that collaboration makes things safer, makes things better.
Well, and the thing I like is you don't have to fill out a form for every single person you see. That does make it easier.
I get that a lot.
So you've talked about 3 patient types. Talk to me about that.
So the 3 different patient types we phase those into 3 different phases of care.
Okay.
So are they in their active care, like they're acutely injured? So we have the acute injury, we have the chronic injury, but also then we're in the kind of a maintenance area. So there are some conditions we just can't fully resolve and we have to maintain those. There are healthy conditions that we maintain, like what you were talking about earlier, where we treat the patient every 4, 6, 8 weeks or so, just to kind of keep them tuned up like that high-performing car.
Right.
But there are also some patients we have to treat to keep them from sliding backwards with their healthcare. So there are different levels of healthcare. So basically we're acute, our chronic, and then our maintenance type of patients. So the acute ones we get in right away. Those are the easier ones to fix because the faster we can get a hold of an injury or an illness, the easier it is to get. So if you have something going on, please don't wait long. Get in, let's get things checked out, because sometimes, give you an example. I have a very good neighbor. He's a very good friend of mine. He tore his bicep tendon completely loose. And he came and talked to me and I said, you got to go, it's surgery time. Let's go look at that. And he didn't. He's like, no, I don't want surgery. I don't want surgery. My arm still kind of works. I can still do this. Maybe I'll check it out later. He waited and waited and waited. And then he came over and he said, this isn't getting any better and I'm losing function. Let's go have it checked out. And then we went and had it checked out. And the surgeon said the end of that tendon has been gobbled on so much by the immune system that I have nothing to attach to now, because it got so soft, so mushy, and so atrophied that the surgeon literally physically couldn't stitch anything to that because the stitch would just tear right.
You just waited too long.
We waited too long.
So people need to get there right away.
Oh, yeah.
And check things out. Talk to me about, like, what is a really good balanced diet?
Good balanced diet has a mix of all types of things. It has some really good fats that come through nuts, that come through fish, such as our omega-3s, our essential fatty acids. So when we look at the 60 necessary things in life as far as nutrients that we have to do, and this is probably a different podcast, so we can delve into that, we're going to have to look at the different essential amino acids, the essential fatty acids. And essential means that we can't make it. So there are certain amino acids that we can take amino acid A and amino acid B, break them down, and we can rebuild it into the amino acid that we need.
Okay.
The essential one, those are non-essential because we can manufacture those. The essential means we have to get those from diet. If we don't have them in good amounts and proper amounts and through a healthy source, we don't function well. We lose a lot of that. Starts to show up in brittle nails, hair falling out, energy decreasing, lack of sleeps, high stress levels, anxiety. That's how we start to see those things manifesting.
So how would we get those into our system?
We get those into our system. We can sometimes get them through supplementation, and it's there. This is another challenge: is there are 7 million different places to get calcium alone. What kind of calcium? Calcium lactate, calcium citrate, calcium this, calcium that, different forms of potassium, different forms of magnesium. Those are all very hard to find a very good source of them, because out of the many different types of magnesium, there are ones that help you sleep, ones that help you with digestion, different forms of magnesium that'll help with stress, that'll help. So there are different forms, and that's where your healthcare provider comes in. They should know that. So going back to your previous question, what should we look for in a healthcare provider? First off, what are your goals? Is it my goal just to get out of pain? Just about any chiropractor, MD, massage therapist, physical therapist can help you with that. Pain management, getting you out of pain is sometimes the easier thing. Maintaining that is a little more challenging. And I'm talking about just your basic average discomforts, not like, hey, I really tore this loose and I have something major to recuperate from.
Okay, so I know in the diet, you say stay away from the windows, right? And there are some diets, though, that I think you like and that you recommend.
Yes, I do like the Mediterranean diet. I do like intermittent fasting, because that's when we're talking about that mitochondria. Intermittent fasting actually makes your body improve the function of the mitochondria. It helps it to create more biogenesis, create more of those for us.
So intermediate fasting, you say it's like maybe you wait till 11 to eat instead of having breakfast.
Yes.
Or would it be, what about fasting for the entire day, just with water?
Do really well with that. Yes, and it depends on what you want to do. Some people do that every 3 days, every 5 days, once a week, once a month. It really depends on what you're capable of doing. And I say it that way because some people with certain metabolic conditions can't do that. So I can't have a 20-year diabetic who's insulin dependent fast for an entire day. That's where we have to take that all into consideration, and that big spectrum of things going on. But we're talking about our average patient. Intermittent fasting is great. So just an example of the intermittent fasting that I do. Every day I stop eating at 6 or 7 p.m. and I don't start eating till 9 or 10 in the morning. That duration of intermittent fasting helps me to get into ketosis, burn fat, eliminate toxins. It helps improve mitochondrial function. And then I don't just charge in with a bunch of sugary types of things. I go in with a nice protein base or a nice grain base type of thing that is going to allow things to come into my body in a natural way. So, go ahead.
Yeah. So with a nutritionist could help you with that.
Nutritionists can help very, very.
Your doctor or somebody that is actually trained.
Yes. I have found that more into the alternative spectrum is where you're going to find your best nutritional advice.
Okay.
Some of your more into the medical spectrum is where you're going to find your better advice on advanced conditions that really need medical intervention. So that's that spectrum.
Yeah.
MDs, my medical doctor friends, are not as good at nutrition as I am, because I'm more into keeping you healthy. They're like, hey, I'm saving lives that are ready to, that could go in the next year or month or whatever. And that's their focus. They're trying to save the ones before they go, which, God bless them for doing that. They're experts at it. I want to keep you healthy while we're alive. And so that's where I'm better to talk to about these natural alternatives.
I'm hearing all the time, Diana, drink a lot of water. You need to hydrate yourself, right? In fact, you tell me that a lot.
Yeah.
So let's talk about hydration. What are some things that we can do that will help us just besides drinking a lot of water?
Absolutely. Water is the universal solvent. So it is what is necessary in the body.
Mhm.
We're 60% water. So we need lots of hydration, and we get a lot of fluid intake, but it's actual hydration that I'm looking for. I like waking up in the morning and I have a very nice cup of coffee that I prepare my way.
Yeah.
That's great because it's kind of a ritual. It's early in the morning, the sun's coming up, I can hold something warm and sip on that and just start to plan my day. That's something that I like to do, but that's not hydration, even though it's coffee, because it has a diuretic aspect to it and it has some acid in it. That's not the hydration I'm talking about. We're talking about waters and different things to bring in electrolytes and hydration into the body.
Yeah.
So typical rules of thumb are whatever your body weight number is. So we're going to just use some round numbers, like somebody weighs 100 pounds. Half of that number is what you consume in ounces per day.
Okay, so 50 ounces a day.
If you weigh 100 pounds, you got it, nailed it. I do like lemon in your water because that does help us to burn fat, believe it or not. It helps detoxify the liver. And even though lemon juice is slightly acidic, when we ingest it, it helps alkalinize us, which is really cool.
So the lemon will actually help us to hydrate better.
Yes, it does.
So
Absolutely.
I noticed you said that in years past that you take lemon juice before every meal.
Yes, that does help prepare the stomach. It does help hydrate, but it also helps get the acids going in the stomach. The body will then later turn it into a little bit more of a buffer for us, which does help us as well.
Well, and to build muscle, what are some things that we could absolutely have in our diet to help us build muscle?
One of the things that we can, as ginger, I believe it or not, helps build muscle.
No, wait, I just eat ginger.
You can. And it is a great anti-inflammatory.
I like ginger. I mean, it's great.
Yes.
So anything ginger can help us build muscle.
Yes, it can help us build muscle. The other thing that I tell a lot of my patients, chronic pain patients, is if they start taking some ginger root, you can shave it down, boil it, and create a little bit of a concentrated juice out of it if you don't mind the taste of ginger or if you like it. It is a wonderful anti-inflammatory.
So you could use like a tea.
You can make a ginger tea.
Okay. And as far as other things that we can do to help our body, you mentioned sleep earlier.
Yeah.
Is there anything that we can do to help us sleep?
Natural things, so you're not taking any supplements, believe it or not. If you take a cooler or cold shower before you go to bed, it does help you sleep better.
I'll be darned. Most people are doing the cold plunges in the morning.
Yes.
So at night.
Cold plunges are wonderful and it depends on your temperature. I love the cold plunge. It is a wonderful way to settle your mind. Did you know that it is next to impossible to think about or, the ruminating thoughts, for example, right? It's hard to ruminate about future or past if you're cold. So if you are in a cold
I did
plunge,
not know that.
you are in the present, in the moment, because it's cold.
Yes.
So when you are in a cold plunge and you're up to your neck in cold water, you're not thinking about all the troubles in the future or all the past things that have gone wrong. You're like, I'm cold right now.
Well,
so that is one way to ground in the moment.
Yeah. And being in the present is one of the best energies you can have. And so now you're giving yourself more energy. So if they don't have a cold plunge, they could just actually turn the shower on cold.
Just turn it. It doesn't have to be freezing cold.
Yeah.
Cooler. The warm shower is relaxing and it's nice and I love that. You can end that way. You can begin that way, whatever, just a little bit of cold in there, just to cool your brain down. It will center you, bring you right to the moment. And believe it or not, your body knows what to do from there.
Okay. And you know how much I love studying the brain. So let's go there for just a moment because water, if you don't have enough water, it actually affects the brain.
Very much so. Dehydration will not only lower IQ, lowers cognitive function, higher centers of reasoning. So they diminish in function because we're just not hydrated. So let's look at the effects of dehydration. So people go out and they party all night and they drink and they get dehydrated. The next morning, what do they wake up with?
Hangover.
And that is mainly from dehydration and swelling, not of the brain, or the brain tissue, but the meningeal linings in the brain. So the meninges that's the cloth covering on the outside, the dura. So that's swelling in those areas. That when that swells, that's where that wicked headache comes from. Dehydration on top of that, you get nauseated, you're not feeling good, you can't think right. You just like, I'm going to go to bed and close the blinds and turn off the light.
So that's why a lot of people with headaches may help them cure it by hydration.
Hydration can definitely help in all cases of a lot of different things we treat.
I'll be darned. That's very interesting to know. So that is one of the best things. So sleep, hydration, putting great food into our body. And sometimes we do need supplements. I mean, I'm a big one. I take a lot of supplements every day, and it seems like the older I get, the more I get, right?
Yes.
So I know you can't diagnose. We're not doing that on this podcast. We're not telling you run out and get these supplements.
Yes.
Yet, what is important for someone to say to their doctor, their DO, or their DC, or a nutritionist? Like, tell them what's going on in their body, tell them when the energy gets low or high.
Depends on, first off, like we were talking about, depends on what your goals are. Depends on also what's ailing you. So if you're worried about energy, then I would start to work on the rhythmic aspects of our endocrine system. I would then start to bolster and build up that way. And it also depends on the age of the patient. So one of the main things that I like women to be on is calcium, a good solid calcium that is going to help with strong bones, because osteoporosis hits women more than men.
Right.
And that is a lot of that is hormonally driven. As we age, those change. And so we definitely need to bring in the calcium into the body. Good supplementation rule for that is 1,000 to 1,200 milligrams a day through a good calcium source. And the body will be able to pull it in and do the rest from there.
And so when they meet with their nutritionist, they say what they're doing, make sure they know of the activity. By the way, one of the things we were talking about the other day is walking.
Yes.
That if you can't do any other exercise, walking is really good.
Movement is life. That's what I
like that phrase. Movement is life.
I have a big little banner of that in my office.
Yeah.
Movement is life. And because if we can still move, we can still function. We improve lymphatic flow. We work on circulation and cardiovasculature. We also work on joint movement. So there's also another phrase that says motion is lotion for joints. If joints are stiff and aching, movement, believe it or not, within reason, within the spectrum of normality for that patient, is very healthy for that, because we turn over synovial fluid, we get things going. Good hydration comes into play. So if you're dehydrated, that goes deeper and deeper and deeper into the body. So let's go deep into a joint. If you're dehydrated, do you think that synovial fluid is going to be watery and slippery and cushiony, or do you think it's going to be thick and viscous and
it's going to be bad?
It's going to be bad. So the oiling system or the lubricating system for our joints needs water too. So if we only drink a little bit of water, the rest of the body for metabolic function gets priority, and everything else will start to suffer. So if you're going, well, my skin isn't really plump like it used to be, it's, well, how much water are you drinking? My joints are stiff. How much water are you drinking? Because we need to hydrate every cell in the body, not just for physiological function. That's why it says, the 50% of your body weight is a good rule of thumb.
So we've covered sleep, we've covered hydration, we've covered having that lemon juice.
Yeah.
I like that before you eat. It will actually help you digest everything. Does it help you lose weight at all?
Sometimes. Yeah, if we detox the
Not a guarantee.
Not a guarantee. Yeah, there's some different aspects that go into weight loss that we go through individually with patients. So going into the supplement aspect, something that we do in the clinic that not many clinics do, we actually go through via history questionnaire, and we customize nutrition for you, or we can even go as far as drawing your blood and finding out through your lab work where you're deficient. And then we customize making nutrition for you through that. And that's the way that healthcare is heading in the alternative realms.
Yeah, I think it's so individualistic that we've got to know our body.
Yes.
And sometimes even just keeping a little bit of a journal when you're going through something as to, like, when, for example, I said earlier, when the energy starts to deplete.
Yes.
Then you kind of know what you can do and how you can help yourself with that energy.
I'm really glad you said that just a second ago, we have to know our body. That you're the one who knows your body the best. I'm the one who knows mine the best. So when looking for a doctor, did they listen to you? Because if they just go in, hi, Bob, how are you? This is what you're doing. Okay, this is going on. Boom, here's your script. Get out of here. Or here's your treatment plan, whatever. And they're not going to listen to you. Go on to the next, because there are enough doctors out there who want to listen, who want to learn about you so they can really find out what's going on. The next thing that's very important is the derivation of the word physician or doctor actually means teacher. So that's what physicians and doctors are meant to be first and foremost. We're supposed to teach you about you and about your health and about your health care. Our healthcare system in America has really branched away from that. That's one of my big griefs with some of my colleagues is they're not taking the time to educate the patient, to talk to them about why are you doing what you're doing and what is it that we're doing, and when we're doing that, what is going to be the outcome, what are possible side effects of that. That's where the education comes into play, and how can we prevent this in the future?
Wow, this is so good. I've always said, and in the book it says you can't get to better until you get to different. So right now, give us 3 things that when they leave this podcast that you absolutely trust they will do and you'd love for us to do.
I would really like to see people hydrate more, try to get better amounts of sleep. Don't push yourself too hard because it's that pay now or pay later thing that you brought up. It's going to happen. Are you going to pay for that lack of sleep now, or are you going to pay for it later? And so I'd like people to focus on the hydration, sleep, and just really focusing in on their diet and finding that really good healthcare provider that matches with them.
Okay. Well, you've heard it, folks. Those are some things and ways to get better, to become more in your health, because when you've got your health, you are very, very rich.
Yes.
I mean, and when you don't have your health, well, it doesn't matter how much money you've got.
Absolutely.
You can't keep moving forward. So I trust that you got something from this. Be sure and give us your comments. Watch next time and listen to Becoming More, where we're here to help you in all aspects of your life. See you next week.
Thank you.
In your life, you deserve to be more, do more, have more, and give more. And now the Becoming More podcast with Dianna Kokoszka.